Okay, here we go. It's time to lead the horse into the barn and put it in a stall and get this out of the way and finish up with the skull. It's been a long haul, but now finish up with the skull, talking about the cranial base. And there's, where we talked about the main portion of the cranium is actually relatively boring. Cranial base has all these little great little areas you get to hide in. Okay, and so it's an exciting area, but it's also very complicated. So fasten your seat belts, pull down your lap bar, and we'll get ready to go here and talk about the cranial base. Okay, first of all, let's talk about the cranial base, like from and if we're thinking about this here, from anterior to posterior. So anterior to posterior. So what do we have? We have the alveolar arch, which is basically formed by the maxilla. We talked about that previously in a couple of our other cranial discussions. Basically, that's the alveolar process. Okay, the alveolar process is the area that hold the maxillary teeth in. Okay, and that's basically all this. That alveolar bone that's very porous and very a lot of little holes all over it. So the roots of the teeth could fit up in there. So that's the alveolar arch of that. We have the palatine process in the maxilla. If you look right here, there's a little line right there. There's a little line right there coming across, and basically everything up to that line is the maxilla. Everything on this side of the line is actually called the palatine bones. Okay, so we have the palatine process of the maxilla. Okay, and if I was to draw that in, that's this area up in here. There's the dividing line, and back in here would be the palatine bones, and back in this area right there. Okay, sphenoid. Okay, you know what? I did this video, and I said nope. I had to do it again. I went back and got a couple of things and added, because I really had to include my nemesis, the sphenoid, which is this large bone there. It's a really bizarre bone. You could probably just get a PhD alone just on the sphenoid. So we'll be talking a lot more about the sphenoid, both inside and outside. Okay, so we'll talk about that in a little bit. So that's the sphenoid. The vomer is this little area right in here. We talked about the nose. The anterior portion of the nose is flexible because the septum, and the word septum, okay, septum, S-E-P-T-U-M, means wall. Okay, that means wall. So the wall between the right side of the nose and left side of the nose is called the nasal septum. And in the front part, it's cartilaginous, so it's going to bend. But once I get back there, it becomes bony. And that goes all the way back to this area here, the posterior nasal choana right there, which is basically where the nose will end or terminate in the nasopharynx at the very back portion of the nose. And if I go down, I'm back in the oropharynx in the back of the mouth. Okay, so that's the vomer. The vomer is that little bone right there. Temporal bones, we've talked about those a lot so far. We'll talk a little bit more about the temporal bone and how it contributes to the cranial base, and then obviously our good old friend, the occipital bone back there. So we're going to talk about each of these bones and each of these sections, each of these areas respectively. Okay, so we'll go with that. Okay, so everybody knows where we're going from, all the way from the alveolar arch anteriorly to the occipital bone posteriorly. And again, this is what we're looking at a skull. Basically, here would be my alveolar arch coming here. You can actually see it probably a little bit better. If you look right there, there's a little line right there, and it's on both sides. So this would be the maxillary portion of the hard palate. Okay, that's the palatine, or what's called the palatine process of the maxilla. And this area in here, and I'll draw it, and let me draw it and outline it by red. That part right there and that part right there is the palatine bones. Okay, the palatine bones that come together. If you take your finger after you wash your hands well and feel on the inside of your mouth, there's going to be the hard palate. And the last little bit of the palate is the soft palate, which is basically muscle that's surrounded, that is covered over by mucous membrane. And when we swallow, that soft palate rises up and seals off the back of my nose, so you don't keep shooting corn out your nose when you eat it. But what happens is that if I look at the hard palate, the front 2/3 to almost 3/4 is basically from the maxilla, and the posterior portion of that hard palate are the palatine bones. Okay, you can't see it here. You can see the vomer right here on this side, and that's the vomer, that little triangular shaped thing. It's almost like it's a wall that goes through. Okay, vomer would be right here in this area on the left hand skull. The sphenoid, again, we'll be talking a lot about the sphenoid, and the sphenoid is basically this whole area up in here. It goes up towards the orbits and stuff like that, and we know it contributes to the part of the orbit. That's all this pink area in here would be all the sphenoid. Okay, temporal bone. Okay, we talked about the temporal bone before. Temporal bone is basically going to come from here, and it's going to involve everything this side of the sphenoid back in here. That's all temporal bone. This is all temporal bone coming here and up until the area of the sphenoid. So this would be temporal bone, that's a sphenoid, and then we have a good old friend, the occipital bone, set back there. So here's the temporal bone, here's the sphenoid right there, okay? And we'll talk about those, like I say, individually. We'll get a little closer to each of those. Okay, let's talk about the anterior portion. We'll talk a little bit more about that hard palate. Again, that hard palate is formed by the palatine processes of the maxilla anteriorly. And if I look again here, you can see that little squiggly line right there where we divide the maxillary portion, the palatine process of the maxilla, from the palatine bones back in here. Okay, so that's what we see with that. These are called the horizontal plates of the palatine bone. This right here and this right here, horizontal plates of the palatine bone. Why? Because they're part of the palate and they're horizontal. So that's a good reason, I think. That's a good reason to see. And then this right here is where we have the opening. This is if I took a pencil and stuck a pencil up through here, I'd come out the nose. Okay, now if I took a pencil through the nose, I'd come out this area right there, and that's actually called the posterior nasal aperture or posterior nasal choana, which is basically this opening right here, and that'd be covered with mucous membrane and enter into the nasal area, into the nasal pharynx once I got past there. So let me get rid of this stuff here. Okay, a couple other things I'll show you here in the area of the roof of the mouth. Okay, another area we'll talk about is the incisive foramen. Okay, and that's this right here. And again, you got to remember, foramen is usually for a nerve or a vessel to come out. So basically, the nerve supply. If they a lot of times when they do a block, all they do is they just put a little bit of local anesthetic around that nerve, and wherever that nerve goes after it comes out of that hole is going to be numb. Okay, so that's how they do that, and to just put a little. They don't have to inject you all over the place. They just go right over the top of the nerve. Okay, so that's called the incisive foramen. It's just posterior to the central incisors. Here's my central incisors right there. Okay, and then we also have the palatine foramina, which are back in here. There's a greater and a lesser. Always the greater is going to be the bigger one, and the lesser is going to be smaller. So those are the palatine foramina, also for exit of nerves out through that area as well. Here we go, looking at the skull itself, and here's the palatine process of the maxilla. You can see the little area right there where so this is maxilla. This is maxilla. This is where it unites in the middle, okay? And that's a palatine process of the maxilla, and these are the horizontal plates of the palatine bones, okay? That's that. And again, here's going into the nose, going through into the nose from behind. Here's the incisive foramina. Let me get rid of that. A little bit of that. Here's the incisive foramina right there, okay? And we see the palatine foramina right here and right there, okay? And again, every time you have a foramina, it's for passage of something. Here's the palatine foramina here, here's the incisive foramina right there. So we can see those pretty well when we look at our image on the left as compared to the diagram on the right. Pretty easy to see how they all compare. Again, and then looking a little bit more, here's the vomer. You can see there's the edge of the vomer, there's the edge of the vomer, but there's the spike. That's that vertical peak of the vomer, okay? And then we have what are called the lesser and the greater wings of the sphenoid. Now, I'm going to have you hold on to this for a little bit. This area that sits on the top, this area, actually it's hard, you can't really see, you can't see it on the bottom. We're going to see it more, the sphenoid, when we get inside the skull, inside the basin of the skull. But basically everything here is all going to be sphenoid. Okay, that's all sphenoid bone. It has a lesser wing and a greater wing. You can't see them here very well. You're going to actually, this is going to be the greater wing area in here. The lesser wing you can't see. You have to look on the inside of the skull for that. So that's basically the greater and lesser wings. Here you see the the greater wings. Lesser wings we'll see in a little bit. Okay, pterygoid processes. What happens is we find this right here these are called the pterygoid plates, and they're from the inferior surface of the sphenoid. Okay, it's hard to you can see a little bit in here, some pterygoid plate area in here. But what happens is, we talked a little bit about this before. When you close your mouth tight, real tight, what happens is that's that temporalis muscle that we felt before up in the temporal region, as well as another muscle at the angle of the jaw, which is called the masseter, which is a really exceptionally strong muscle. And they open the mouth really tight. Okay, they open the mouth really tight. I mean, it's late. They close the mouth really tight, not open. They close the mouth really tight, hold the mouth really close. Okay, to open mouth is more passive. Okay, however, let's think about that. What about this? That looks really weird. What does that are these two other muscles called the medial and lateral pterygoid muscles. Okay, and the pterygoid muscles will have their attachment to these pterygoid plates that are in there. Okay, so that's all about that. We also have what's called the spine of the sphenoid. We can see the spine of the sphenoid in this, and the spine of the sphenoid is this area right here. Is this area right here? Okay, and basically it's for attachment of a cartilaginous portion of what's called the pharyngotympanic tube or the eustachian tube. When you ever notice that when you're going up in a plane, sometimes what will happen is your hearing starts to get muffled, or when you're in a car or going up a hill or something like that, and all of a sudden your ears feel like they're full when your hearing goes down. Well, the reason why that happens is we have our ear canal, and then we have our eardrum, and then behind the eardrum I have what's called the middle ear cavity. Okay, and that's where all those ossicles, the hammer, anvil, and stirrup, malleus, incus, and stapes, sit inside here. Okay, what happens is I need to have the air pressure outside the tympanic membrane, and the purple would be my tympanic membrane. I have to have the air pressure outside the same as the air pressure inside. Okay, and that way allows the tympanic membrane to vibrate when sound waves hit it. Sound waves will come in through this canal from the outside. This would be where the ear would be the pinna, or the big flappy thing. Okay, and the air and the sound would come through there and would cause the tympanic membrane to vibrate. But to vibrate unencumbered, I have to have the pressure on both sides equal. Okay, well, what happens is that middle ear cavity, okay, if this is my middle ear cavity in here, let me draw it in a different color. If this is my middle ear cavity, it actually connects to the back of the nose by a tube called the pharyngotympanic tube or the eustachian tube. Okay, and that allows the air to go up through here. When I open my mouth, the air goes up through there, and it equalizes the pressure on both sides of the eardrum. Okay, what happens is sometimes when people have a cold, the mucous membrane that lines that will actually close off, and therefore I can't equalize pressure. That's why sometimes your hearing gets muffled when you have a cold. Okay, or when you're going up in the plane or something like that, what happens is the pressure in the cabin will actually cause that tympanic or that pharyngotympanic tube to actually collapse and close shut. So then what do? You swallow, you blow out, and that opens up the eustachian tube, pharyngotympanic tube, and equalizes the pressure. So basically what actually gives some support to that, is that little area of the sphenoid, which we know as called the spine of the sphenoid. Okay, the spine of the sphenoid, basically in this area right there is a spine of the sphenoid. This area right here, this area right there, and that's for attachment of that cartilaginous portion of the pharyngotympanic tube inside that, or around that. The mandibular fossa, we talked about this before when we talked about the mandibular, the condyle. Okay, here's the condyle of the mandible right down here. Let me draw it in a little red. Here's the condyle of the mandible, and that sits in that joint. Okay, that fossa, there's a fossa that's in the temporal bone. The temporal bone has that fossa. So if I look up here at this diagram, here's that mandibular fossa here. Here's that mandibular fossa right here. Okay, if I look in the diagram here, here it is here. Here it is here. And that rounded condyle of the mandible sits in that mandibular fossa, and that allows the jaw to open and close. We did this before. If you take your hands and stick it in front of your ears and open up your mouth, you actually feel the condyles come forward and out. They almost like dislocate. They what we call sublux. They come part way out of that joint, and then when you close your mouth, it goes back in. Okay, and that's that mandibular fossa that's there. It's a small depression in the temporal bone that accommodates the condyles of the mandible when the mouth is closed. When the mouth is open, obviously they move forward. The condyle moves out a little bit anterior to that mandibular fossa. Okay. And if we're looking at the diagram here, here's the condyle right there. Here's the condyle, and here's the mandibular fossa looking from the side. If I'm looking from the bottom at the cranial base, here's that mandibular condyle right here. Here's the mandibular condyle. If you look, here's the zygomatic arch coming right there, and you can see the zygomatic arch coming right there. So it's right at the base of the zygomatic arch. In that area, we see that. On this hand, on the other side over here, what are we missing? Looks like the zygomatic arch was broken off at some point, and so I'm just connecting it. So that's where that mandibular fossa would be. Okay. Again, that both the condyle as well as the mandibular fossa are aligned with cartilage, with that hyaline cartilage, which allows a smooth surface like we talked about before. So it allows the movement to be nice and smooth and even. Okay. If we look a little bit more at the posterior aspect of that cranial base, the occipital bone, occupies most of that. Again, we have the sphenoid bone, which is going to be in this area, occipital bone back here, and the temporal bone is going to be on the side. Over here is going to be the temporal bone. So if you look down here, here's occipital bone, okay? Here's a temporal bone, here's a temporal bone, and then very anteriorly, I got the sphenoid bone up in there. So sphenoid would be up in here, occipital bones back in here, and temporal bones on both sides like that, as we can see. Okay, probably one of the most dramatic things that we find in the posterior cranial base externally is this large thing right here. Okay, and this large thing right there is called the Foramen Magnum. That's the Foramen Magnum. And the Foramen Magnum, foramen means hole, obviously, and magnum means large. So it's a very large hole. And this Foramen Magnum is for the spinal cord to leave. Once the spinal cord comes out of the brain, it has to go somewhere. It can't just automatically teleport itself on the other side of the skull. So it comes out through this hole. Okay. One of the problems that we get with this Foramen Magnum is when people have head injuries, the brain starts to swell. Okay, and when the brain starts to swell, it tries to force the brain out the foramen magnum. Why? Because it's the biggest hole in the brain, or the biggest hole in the skull. So it tries to force the brain out that, and pushes some brain centers that are involved with like respiration and heart rate and stuff like that. Pushes against this. On the inside, this is called the clivus. It's sort of like a little ramp. I'll show you what that looks like a little bit later. And it pushes that stuff against there and tries to force the brain out this. It's called a herniation. Okay, or herniation of the brain, and that could be fatal. So that's why a lot of times people who have head injuries, they put them in an induced coma, and they give them a very large, powerful diuretic to try to relieve a lot of the swelling that's in their brain. Okay, and that prevents that brain from herniating down through that hole. Because guess what? You ain't going to get the brain out the hole, but you're going to squish a lot of stuff on the way out. Okay, so that's the foramen magnum. That's something you should never forget. Okay, occipital condyles. Okay, when you think about the occipital condyles, we've talked about these before. And if I look at where they're at, there it is right there, and there's an occipital condyle right there. There's it right there, and there's it right there. Okay, and the occipital condyle, if it's hard, you can't tell here because it's not three-dimensional, but it's round. The bottom of the occipital condyle is round. And that's important. It's important because we know that what happens is that area meets with the atlas. Let me do another color here. If I see it, that's not even good. Meets with the atlas down the bottom. Let me do it with a cheese. Okay, let me draw this again. Let's start again. Take it back. Okay, so the occipital condyle is round, and that's going to meet with the atlas, those articular surface on the atlas, which is concave. And that allows, because they're in an anterior posterior direction, the orientation of these condyles and the facet, again, they're both lined with articular cartilage, allows the head to move in a sagittal plane. This type of thing, yes sir, yes sir. It allows it to move in a sagittal plane. And those are called the occipital condyles, okay? So this would be the occipital condyle, and this would be the articular surface that opposes it on the atlas. So this would be the atlas down here. Atlas. Everybody should remember what the atlas is, okay? So that's that. Let's get rid of these things. A couple of other things I want to show you here, and then we'll head on. Okay, the next thing I want to show you is the jugular foramen. The jugular foramen. Now the jugular foramen we can't really see on the bottom. Okay, you can't see it. It's going to be right about, if you were to look at where it should be right about here, and it should be right about here. I do see it right here. This little area right there. That would be the area of the jugular foramen. Now, what do you think is at the jugular foramen? Obviously, the internal jugular comes out of there. But it's what happens is that inside the skull, we don't really have a venous structure like we have in most of the other body, or most of the rest of the places of the body. What happens is that the skull, or the brain, is covered with membranes. These membranes are called meninges. And the outer meninge, or the outer membrane, is called the dura. It's very tough. It's very durable. And it's basically two layers. Okay, it's like two layers. One layer, and these two layers are stuck to each other like that. But in various places inside the cranium, what happens, I have my one layer that's stuck to the inside of the skull, and the inner layer of that actually comes comes down and forms a little gap like that. And what's inside there? Venous blood. Venous blood fills this inside in there. And as a result, what happens, I drain a lot of the venous blood that's going back to the heart from the brain through these venous sinuses, okay? And what happens is the venous sinus comes around. I'll show you, it's like a little toboggan chute that comes around, and finally it exits, it attaches right to the inside of the skull at where the jugular foramen would be. And then from the outside, coming out of that would be my internal jugular, okay? Besides that, besides the jugular vein in there, we also have a couple cranial nerves. These cranial nerves are the ones that come from the base of the brain, and they come directly out through all these little holes. If you look at, there's a lot of little holes all over in the base of the cranial base, okay? And what happens is cranial nerves 9, glossopharyngeal, cranial nerve 10, vagus, and cranial nerve 11, accessory nerve, also come out through that jugular foramen. Okay, so that's that. The carotid canal. Okay, the carotid canal, you could figure out what the carotid canal really means. And the carotid canal is basically the area, and you can see the carotid canal right there, and you can see the carotid canal right there. On the outside, it looks like just like a regular hole. On the inside, it's a trough. Okay, and what goes into that carotid canal is the internal, it should say internal carotid artery. The carotid artery actually comes off the area of the aorta or off the brachiocephalic artery if it's the right, and if it's off the aorta if it's the left. But we'll talk about that later. And it gets up to about the level of the middle of the neck in the thyroid, and it splits. One part of that carotid artery goes to the outside, covers the face and stuff like that. It has one branch that goes inside. We talked about that earlier, and that little branch, that middle meningeal artery that actually goes in through from the external carotid inside the skull, but most of the external carotid goes to the face and stuff like that. The internal carotid does nothing until it goes through that hole and it gets inside the cranium, which it contributes to something called the circle of Willis. We'll talk about that when we talk about the brain and we talk about vascular supply. Okay, so that's the carotid canal. Mastoid process of the temporal bone right there, right there. Right there, right there. We've seen that before. And the stylomastoid foramen. We really can't see it here. Okay, and either of these, you don't see it. Well, you maybe see it a little bit on the one up here, on the one on the top. If I look right here, there's a little hole. It looks like right there. Here's the mastoid. Here's the styloid process, and right between the two, there's that little hole right there. Okay, let me erase that, and you'll be able to see. See that little hole between the two? Right there. That's the stylomastoid foramen. And again, yeah, it's great because you got a very important nerve that comes out of there, okay? And that's very critical, okay? Cranial nerve 7. We'll talk a little bit about that later on, okay? Again, if I'm looking at the skull, here's the mastoid process right here. Here's the mastoid process right here. Mastoid process right here. Here are the occipital condyles for the area of that articulate with the atlas. Here's my foramen magnum for the spinal cord. We could see the jugular foramen here a lot better. Here's the let me do it in blue because obviously venous blood, okay? Here's the jugular foramen right here. Here's the jugular foramen right there. Here's the carotid canal right there. Carotid canal right there. And that's pretty much what we see. You can't see much of the stylomastoid foramen here because this is a plastic skull, so you pretty can't see a whole lot there, okay? But that's what we see with that. Now, that's the outside. The inside gets even better, okay? If you thought the outside was cool, the inside is even better. Now, here's what I want you to do. Before I get to go on here, I want you to take your pencil that hopefully you're taking notes, or you're not, hopefully you're awake. Hey, wake up if you're asleep. But if you're not asleep, I want you to take your pencil and I want you to draw me a picture of a brain. Just draw me a really quick, 3-second picture of a brain, okay? Ready, set, go. Okay, I'm almost guarantee it. I don't see you guys, but I'm almost guarantee you what's going to do is you're going to do something like this. That's going to look like sort of like that. Okay, tell me I'm wrong. Okay, I'm right. I know I'm right because I've seen this so many times. Okay, and that's what it is. We forgot something though. What happens? You forgot that in the back of the brain there's a thing called the cerebellum. So here's the cerebral cortex. This is the frontal lobe out here. This is called the parietal lobe. This is called the occipital lobe. Sort of like matches what we see in regards to the cranial bones. And this area right here is called the temporal lobe. And here's the cerebellum right there. Well, if you look at this, it's sort of interesting because they come in tiers. There's one level there. There's one level there. There's one level there. They're in different levels. What happens is the inside of the cranium accommodates for that. And it has what are called three cranial fossa. Three cranial fossa. We have an anterior, a middle, and a posterior. This is the anterior cranial fossa right here. Okay, so this is anterior. I should have done that in purple, huh? This is anterior. This area in here is anterior cranial fossa. This area from here to here is a middle cranial fossa. Piece of cake. This area here is the posterior cranial fossa. Okay, and they're at different levels. The anterior cranial fossa is higher, the middle cranial fossa is a little bit lower, and the posterior cranial fossa is a little bit lower than that. And that accommodates for the three levels of the brain. This supports the frontal lobe, this supports the temporal lobe, this supports the cerebellum in the back, all in three different levels, okay? Which is actually sort of cool. So if I'm looking at this, this is a diagram that sort of shows that. Now, the diagram on the right shows how the different bones contribute to that, the cranial fossa. Everything up in here is my, let me do that in black, this is my anterior cranial fossa. Okay, and that's the highest. The green here is the middle cranial fossa, and that tan is the posterior cranial fossa. Now, if you look at the picture on the right, okay, here's the anterior cranial fossa that comes across like here. Here's anterior cranial fossa, this whole area in there. And you see what happens is most of it is the frontal bone, the blue bone, but we do see another bone in there, this purple bone, which is called the ethmoid bone. We'll talk more about that when I talk more about the anterior cranial fossa. And we see this bone right here, which is the sphenoid, and that's called the lesser wing of the sphenoid. Lesser wing of the sphenoid, okay? And it means the lesser because this one down here is called the greater wing. So the lesser wing of the sphenoid is part of the anterior cranial fossa. If I look at that middle cranial fossa, this area in here, my middle from here to here, you see that what happens, I got part of the parietal bone that's involved with that. I get a large portion of the temporal bone, so here's temporal bone, and here's the sphenoid. Okay, so I got three different bones that are contributing to that middle cranial fossa. Here's my posterior cranial fossa. I get a little bit of parietal back in here, a little bit of temporal, but I got a lot, mostly occipital bone back here. This area right here, let me just get rid of all this so you can see what this is and look at how the different bones contribute to the different fossae. Okay, but what happens is this area right here, you can actually see, and we'll see this when we look inside the skull, when we look inside the bowl, okay? And that's called the Petrous Ridge. You can't see it very here because it on the left because it's a little bit obscured by the color, but it's called the Petrous Ridge. And the Petrous Ridge is part of the temporal bone. Petrous means rock or hard. Rock or hard. And that's a very hard portion. It creates a nice little ridge, and that ridge separates the middle cranial fossa from the posterior cranial fossa there. You'll see that a little bit later when I talk about that. Okay? So let's talk about that anterior cranial fossa. Now, there's a couple things in here that are really sort of cool, okay? That, at least for me, and you know, a perpetual nerd, I guess, okay? But this is my anterior cranial fossa that's right in here. This is the anterior cranial fossa. A couple things that are really important with this. And one of the bones that we really haven't talked much about at all is this bone that sits right there and sits right there, okay? And that bone is called the ethmoid bone, okay? That's the ethmoid bone, okay? And that's central. Now, this bone is really sort of important. Most of this is all frontal bone. And what happens if I look over in here, this area right here is that lesser wing of the sphenoid, this area in here. What happens is that ethmoid bone we haven't talked much about. The ethmoid bone has a part that sits straight up right here. And if you look, if I was to draw it, it's hard, it doesn't show like it's coming up, but this little area right there, it points straight up. It's like a plate that goes straight up. Now, the cerebral cortex in the frontal lobe has a right frontal lobe and a left frontal lobe with a crack down the middle, or a fissure right down the middle. This sits right between the crack in the frontal lobe, not all the way up, but just a little way, okay? And that right there is called the Crista Galli, or the coxcomb. Please don't use the word coxcomb if on an exam. Crista Galli would be what I'd want, because that's more of a medical term that you should understand. You actually see these radiographically. If you look really close on a lateral view of the skull, you might see the Crista Galli. Okay, but what it does is it's just sort of like right in the middle of this ethmoid bone. What the ethmoid bone is even more important for, okay, is you can see it on both of these images. Okay, around the outside, this is the ethmoid bone. It's embedded in this in the center portion of the frontal bone. If you look, see how little dots in there? Little dots in there. That area that's next to the Crista Galli is called the Cribiform Plate. It's called the Cribiform Plate. The Cribiform Plate. Okay, and that's the Cribiform Plate of the ethmoid bone. And these little holes in there. What happens is at the base of the brain, I mentioned there are 12 pairs of cranial nerves, and they all do something. We talk about the cranial nerves when we get to the nervous system down the road. Okay. But what the first cranial nerve is called the olfactory nerve. Excuse me. The olfactory nerve comes. It has a bulb that. Let me see if I could. It's not doing it very. Let me do it this way. Maybe try it this way. A bulb or a branch that comes to that olfactory nerve that comes this way and this way, and at the end there's a bulb. It gets wide at the very end. It gets wide at the very end. So what happens is that nerve comes out like this, and then at the end it gets wide. Okay, at the bottom of the nerve, though, at that bulb, it's called the olfactory bulb, by the way. At the bottom of that, there are these little strands. Let me just do those in purple, just for continuity's sake. Little strands that come down there, and this is a nerve. So it sends these little small nerve fibers down through all those little holes in that cribiform plate, and where they end up in the very attic, the highest portion of the roof of the nose. So those are my smell factors. That's not that I smell, but those are factors. Those nerves that I smell with. Okay, that's what those are. Okay, and that comes through the cribiform plate. Interestingly enough, sometimes people will actually have head injury and they have a fracture that goes through the cribiform plate. So they get to the emergency room and they notice their nose is running. Why is their nose running? Did you get a cold from that? No, it has nothing to do with that. What really happens is when they fracture the cribiform plate, because the bone is very porous, has all these holes for the olfactory nerve fibers coming down from that olfactory bulb from the first cranial nerve, olfactory nerve. Then what happens is the brain is surrounded by a fluid which is called cerebrospinal fluid. When they do a spinal tap, they take a little bit of that fluid out for analysis. But what happens is that fluid actually comes down through that crack and through the cribiform plate, and it comes down, looks like the nose is run, but it's not. It's cerebrospinal fluid, which is a heck of a lot more significant than giving them a decongestant or an antihistamine to stop their nose running, okay, because that's not the problem, okay. So that's what we see. Also, then again, you see this portion here, the sphenoid bone, the lesser wing of the sphenoid sitting in that anterior cranial fossa. Okay, so that's that. Again, now we're talking. That shouldn't have been there, but anyway, that's just looking at the outside. We already talked about this, but we'll talk about it a little bit. Look at the outside, and then we'll go inside the cranium for this. But this would be that vomer, like we talked about before, and the sphenoid. Okay, now I probably put this in here because the sphenoid is that critical bone. We can only see a certain amount here. We talked about these pterygoid plates on both sides and stuff like that, and the spine is the sphenoid. But this is what we saw from before. We need to see what that sphenoid looks like on the inside, because you know what? This is not that exciting on the outside. Here it is. Okay. Now right here is the sphenoid. This is the sphenoid area right here. That's the lesser wing. The lesser wing is in this area right here. The greater wing sits up in here. Okay. And we have the center portion here, which I'm going to talk about. So basically, we'll talk more about that in a little bit. Here's where that Crista Galli is. Okay, and this is a nice picture because you see all those little holes, all the little dots in there. Okay, and those are those little holes where those olfactory nerve fibers come from that olfactory bulb to go into the nose. Okay, so anyway, that's what we have there. Let's go on. Okay, let's talk about that middle cranial fossa and talk more about the sphenoid, which is like I say, an exciting bone, a really good bone. Okay, that middle cranial fossa has a major thing that's right in the middle, and this thing in the middle is called the Cella Turcica. The Cella Turcica. Cella Turcica stands for or means Turkish saddle. Okay, and what happens is the Cella Turcica if you look, you can actually see we showed it on an X-ray, a skull X-ray from the lateral side. It's a little pocket. It's like a little pocket like this. Okay, it's in the body, in the center portion of the sphenoid bone, the Cella Turcica. And what sits inside that Cella Turcica? The pituitary gland. Pituitary gland sits inside there. It's about the size of a pea, about the size of the tip of your little finger. And on the top of the pituitary gland, there's a stalk that comes right down to it. Okay, and that's called the pituitary stalk or hypophyseal stalk. If you see the word hypophyseal, hypophyseal means pituitary. So this is called the hypophyseal fossa, this little depression, and the hypophysis is the pituitary. Also, what happens is over the top of that hypophyseal fossa, there's a membrane that sort of seals that pituitary down below. Now that stalk connects the pituitary to a part of the brain above it, which is called the hypothalamus. And the hypothalamus tells the pituitary what to do. It's the pituitary's boss. They always call the pituitary the master gland of the body. Okay, if you look at the endocrine PowerPoint at the very end of the year, at the end of the semester, we talk about the master gland of the body because it sends out 8 different hormones that go to affect multiple different organs in the body. What happens is it's the hypothalamus that tells the hypophysis or the pituitary what to do. Okay, there are some other parts of that Cella Turcica. There's a thing that's called the Tuberculum Cell, which is basically a slight elevation anteriorly on the body of the sphenoid. I'll point these things out. The dorsum celli. The dorsum celli is a little block on the back side. I'll show you that in a second. And these clinoid processes, which are like little handlebars. Okay, let me show you what they are, so you'll see what these pieces are. And again, this is a sphenoid. Believe it or not. That's what that sphenoid looks like when it's taken out of the rest of the skull. Very unusual bone. This area up in here is called the lesser wing. Okay, you can see it right here. Here's the lesser wing. Okay, and if you look right underneath here, this is sort of cool. If you look right underneath here in that area, you can't see it on the other side, but you see it right there, and you see right there. That's that superior orbital fissure that we saw at the back of the orbit. That's that little hole right there. This little hole right there is the optic canal. That's where the optic nerve, second cranial nerve, comes from the eye that goes back to the area of the brain. Okay, and I'll show you how that happens. That's really cool. Okay, so if we look at the diagram down here, you can see the lesser wing, which is basically the green area. You see the body, which is in here. This would be the area of the Cella Turcica. If you look at that, where the hypophyseal fossa sits right in there with the Cella Turcica. Okay. Now we talked about some other processes here. This is called the posterior clinoid process. Posterior clinoid process. They're like little spikes that come off of that. Here's the anterior clinoid process. Anterior clinoid process. The dorsum cellae is this piece right here. That piece is the dorsum cellae right there. Actually, it's going to be sitting right here on that. That's the dorsum cellae. So those are parts of the sphenoid that you probably should know. Lesser wing. This down here is called the greater wing. Here's that spine. The spine of the sphenoid, the sphenoidal spine. The Cella Turcica. The dorsum cellae, which is right. Dorsum cellae is right here. Posterior clinoid process, posterior clinoid process, anterior clinoid process, anterior clinoid process. This little shelf right here is called the optic groove, and I'll explain that in just a second. Okay, and this is the optic canal right here. Optic canal pretty much tells. These are some other foramen. Foramen spinosum, foramen ovale. It's in there, and here's called the foramen rotundum. Guess what those foramen are for? A cranial nerve to go out there. Of course they are. Okay, so that's what we have with that. Let me just explain something. This is actually sort of really cool. Okay, let me get rid of all those lines. Okay, and you could actually go back and look at the diagram all you want when you get a chance. But let me just draw something here, and I'll try to see if we could show you what happens. Here's my. Let me get the bigger line. I think we got it together. Here's my left optic nerve. Okay, it's coming out that. Let me draw it a little bit. I didn't like the way it went. Let me just say, here's my left optic nerve. It comes out like that. Okay. Let me draw my right optic nerve. My right optic nerve is coming out here. Okay. Now I have a right eye and a left eye. At least most of us do. Here's the cool thing. This area right here is called the optic chiasm, C-H-I-A-S-M, optic chiasm. And it's an area where part of this optic nerve will actually cross. What do I mean by that? What happens is we're going to find the right optic nerve. Part of that optic nerve will cross over to the left side, and part of it will stay on this side, on the right side. On that right optic nerve, part of it will cross over to this side, and part of it will stay on this side. So each eye is supplied by parts of each optic nerve. So my right eye has both, actually, it's not my eye, but the brain, the signal that's coming. So the eye's out here, it's getting the signal and sending it down there. But what happens is what I see, this nerve, part of my right optic nerve will end up on the left side of the brain. Part of the left optic nerve will end up on the right side of the brain, and part of my right optic nerve stays on the right, part of my left stays on the left. When you ever have the doctor, when you're sitting there and they put their hand on your chin, or you're doing for this sometime even when you're getting your license, okay? But if you're for a physical, and a doctor says, okay, look at my nose, you look at his nose, and says, tell me if you see my finger over here, tell me if you see my finger here, finger here, finger here. Those are called visual fields, okay? And what they're doing is they're actually checking this optic nerve and to check about that crossed area. Okay, because I could go into a long discussion as to how it affects the eye. Okay, it probably, we don't have enough time to do that right now. I could probably do that if somebody asked. I could go into a lot of detail. But what happens is we have what's called hemianopsia. Hemi means half, and means without. Opsia means vision. And what happens is it depends on where I have a problem. If I have a problem in the optic nerve here, one thing happens. If I have a problem with the optic nerve here, something else happens. If I have a problem with the optic nerve here, something else happens in regards to which part of my vision I lose. Because again, in that crossover of the nerve at that area of the optic chiasm, which would be this area right here, which would be this area right there between the optic canals. Okay, sort of cool. I'm not going to test you on that, but that's sort of an interesting thing to talk about. Okay, so a little bit more about the middle cranial fossa. The majority of the middle cranial fossa is still going to be taken up and still going to be comprised largely of the greater wings of the sphenoid. That's this right here. A good portion of it, not all of it, but you know, that's the area of the greater wings of the sphenoid. We also have all the way up to that petrous portion, the temporal bone sitting right there. So here's the temporal bone up through there, and here's my sphenoid, the greater wing of the sphenoid that would be there. Also, the body of the sphenoid is basically in the area of the middle cranial fossa. Okay, and then that goes, the middle cranial fossa ends at this what's called the Petrous Ridge. And if you look here, you can actually see it right here. See that ridge right there? It actually sticks up. It's a very prominent ridge, which then below that you go into that big hole. You go into that big hole, which is that posterior cranial fossa. And basically that's what we see there. Okay, so and then what happens is the posterior portion of the middle cranial fossa is formed by that dorsum cellae, which is that flat area on the back of the hypophyseal fossa. That hypophyseal fossa, Cella Turcica, is sitting right there. Okay, hopefully you understand that. If you have questions about that, please see me. It's a little complicated, but I think it makes sense if you think about it. If you watch this like maybe 10 or 12 times, you'll probably get it down at that point, but hopefully less than that. Okay, I know you're smarter than that, so you could probably get it down with a lot than that. And that's a little bit more about that, about the middle cranial fossa, again with the wings and stuff like that. And you know, we've talked about this before. We have the foramen lacerum, okay? And when we talked about the carotid artery, okay, the internal carotid is going to come up, and you can see here's the foramen lacerum right here. We saw that anterior to the area of the jugular foramen, and the carotid artery is going to come up right through that. It's a carotid canal or foramen lacerum. It comes up, it comes right next to the area of the hypophyseal fossa. So that's that. It's a little bit posterior and lateral. The foramen is posterior and lateral to the hypophyseal fossa, but that the artery comes straight up through there. Okay. Here the optic canal would be right there. and right there, optic canal, we see that right there. Here's the greater wing of the sphenoid, greater wing of the sphenoid. There are a number of other foramen in here. The foramen rotundum, which I showed on a previous thing, foramen ovale, and this foramen spinosum. I'm not going to have you point those out. I'm not going to ask those on an exam. I think it's nice if you really want to know a lot, I'd know what they are, because what they do is various, here's the spinosum right here, and you can see, and there's the rotundum would be in here, and basically, let's see, oh, that's the ovale, excuse me. Here's the spinosum right there. So spinosum, ovale, and rotundum, they're in that row like that, in that order. Hard to see, they're small. So I wouldn't, be that worried about you knowing those, but they're there for cranial nerves that will come out of those areas. Okay, again, here's that same picture that we saw the sphenoid before with my lesser wing up in here. Here's the hypophyseal fossa. Here's the dorsum sellae, clinoid process, clinoid process, clinoid process, clinoid process. And you could follow that down here, and you could look at the same thing up in here and see that again. Okay, but we've talked about that, so that's pretty good. Okay. And again, this is just looking. This is actually a nice little diagram here if you really want to sit up reading late at night and look at what goes through what hole, okay? And basically, here's the foramen ovale, which is part of the trigeminal nerve, the foramen rotundum, which is part of the trigeminal nerve, and then also we have the superior orbital fissure, which is 3, 4, part of the trigeminal nerve, and 6, like we talked about before, okay? Here's the lacerum, right in there, which you can see, which is the carotid will be able to come up through there. Here's the jugular foramen here, which is 9, 10, and 11. Okay, we have 7 and 8 going through the area very close to the petrous portion of the temporal bone. Got to remember 8 is going to be the acoustic or auditory nerve for hearing, and 7 is that facial nerve, which goes through that area of the stylomastoid foramen. Okay. Posterior cranial fossa. The posterior cranial fossa is the biggest and it's the deepest, okay? And because it contains the cerebellum is that big, large, bumpy thing on the back. Also the pons and the medulla oblongata, which are part of the brainstem. They fit in this area right here. This area right here, I mentioned before, is called the clivus. It's a ramp, and the brainstem sits right on that ramp, right in there inside the skull. Okay, the biggest portion of what we have in regards to the posterior cranial fossa is the occipital bone. Obviously, have a little bit of the temporal bone right here, because here's the Petrous Ridge. Here's the Petrous Ridge right there, which divides the middle cranial fossa on this side from the posterior cranial fossa on that side. Okay. What do we see in here? And there's a couple things that are sort of cool in here. I mentioned before that we don't have the same venous drainage process like we have in most other places of the body, but we have these sinuses, okay? And the sinuses that I really want to show you here are the transverse and the sigmoid sinuses. There's a sinus that goes right up the middle along the sagittal suture, just underneath the sagittal suture, and there's some from the side. There's one that comes between the two lobes of the brain, the right half of the brain, the left half of the brain. There's another one comes through there and stuff like that. But if you look right here, okay, see there's sort of like a groove that's up in here, okay, and that's that transverse sinus which is in the back. Okay, and what that transverse sinus does is draining the venous blood, has to get back to the heart, and the transverse sinus comes this way and it goes around this little toboggan chute around this way, makes a little corner like that and out. And what's that? That's the jugular foramen. So this is called the sigmoid sinus that goes out there. So that's the sigmoid sinus. Transverse sinus continues along this way, becomes a sigmoid sinus, and out through the area of the jugular foramen, which is this area right there. That's the jugular foramen. Okay, we see the foramen magnum, okay, we see the clivus, okay, we see that there. Inside, we talked about that external occipital protuberance. We also have the internal occipital protuberance, which is there as well, okay? And that's the same bump, it's just opposite where that would be, okay? There's also a hypoglossal canal. Hypoglossal canal is just next to the area, it's right here. You see it right there and right there. And that's for the 12th cranial nerve, which is called the hypoglossal nerve. Okay, cranial nerve 12, hypoglossal nerve. It goes right between the foramen magnum and the jugular foramen, right between the two. Okay, so basically that's what we see in that posterior cranial fossa. And that posterior cranial fossa contains that cerebellum, the large portion in the back. Cerebellum is going to be really important. We'll talk more about that when we get to the nerve system. And the cerebellum is really important because it's involved in things like balance, coordination, and stuff like that. Okay, more than anything else. Okay, so that's the posterior cranial fossa. And here we go at the posterior cranial fossa, and you can actually see the sigmoid sinus here really well. If I look here, here's the sigmoid sinus coming around that way. You can see that sigmoid sinus coming like that, and it's going out. So that right there has to be what? The jugular foramen. The jugular foramen. Obviously, here's the foramen magnum. Here's the clivus area right in this area. That's CLIVUS. Okay, and that's what we see. That's probably the most important things that we have to see here in this posterior cranial fossa. You also do see a really good representation here of that Petrous Ridge. See how it sticks up right there? And that divides the middle cranial fossa from the posterior cranial fossa, posterior and middle. Okay, so that's that Petrous Ridge right here, Petrous Ridge right there. Okay, hopefully that makes sense to you, and that should be okay. So what have we talked about here today? We talked about a really detailed area. We talked about the cranial base, and the cranial base is where it's at. It's like you could go. It's like you go to a movie now and you watch previews for a while, and that's most of the cranium and the stuff like that. But when you're waiting for the meat of the movie, that's sort of like the cranial base. It has all the interesting stuff. We talked about how we could look at it anterior, middle, and posterior. We talked about inside anterior cranial fossa, middle cranial fossa, posterior cranial fossa to accommodate the different levels of the brain. We talked about a lot of the holes, a lot of the cracks. We talked a lot about the sphenoid. Sphenoid, if you want to read more about the sphenoid, please, if you're really interested in that, do it. It's a great bone to read about, okay? Like I said, you could just get a PhD on the sphenoid alone because there's so many little nooks and crannies on the sphenoid that will drive you batty, okay? So anyway, hopefully this makes some sense to you. Look at it. Again, as always, if you have any questions, please let me know. I'm more than happy to answer any questions you have or go over anything you need to know about or you feel like you need to know about it. I'm probably going into a lot more detail than I'm expecting to know, but you know what? There's nothing like too much material. Okay, I know students sort of like say, geez, that's so much to learn, that's so much to learn. Obviously, I can't ask everything. Okay, I'm going to ask the larger points, I think. There are going to be some finer points that I'll put in on an exam. There's a zingers just to see who really is up on top and stuff like that. But I think most of the stuff should be real things I emphasize a lot, and both here and in when we have our meetings. So hopefully there won't be too many questions, but if you do have questions, please let me know. I love questions. They keep me young. Hasn't worked. But they sort of keep me young. And so if you have questions, please ask. I love questions, okay? In the meantime, as always, be safe and be healthy, and we'll talk to you next time.